Hello, my name is John Camm and I'm Professor of Cardiology at St George's, University of London in the United Kingdom. My thanks to Minister Andriukaitis and the Lithuanian Psychiatric Association for accepting this topic. I'm so sorry that I'm not with you in Vilnius, but I will try and tell you all about this very exciting issue. Dementia is a problem which is seen increasingly often with atrial fibrillation. You'll remember that atrial fibrillation is a disease which occurs particularly in elderly patients, but which appears at younger ages too. We don't know exactly how much atrial fibrillation we have today, but it is approximately 2% of the population. The reason we don't know the exact figure is that atrial fibrillation can come and go. It's also often asymptomatic in the sense that the patient doesn't feel the palpitations associated with the arrhythmia, but of course it may have serious consequences. One of the most important issues with atrial fibrillation is that it is becoming much more prevalent. And the reason for this increase in prevalence is largely because of our aging population. It is forecast that atrial fibrillation will be 3 times more prevalent by 2050. Now, atrial fibrillation is associated with consequences such as stroke. In fact, stroke is 5 times more common in patients with atrial fibrillation. And atrial fibrillation accounts for at least 1 out of 6 of all strokes. We know there are various risk factors for stroke in atrial fibrillation, and the most important of them are age, congestive heart failure, hypertension, diabetes, and a previous stroke. Interestingly, these are common risk factors for another condition, a condition known as dementia. Now, dementia is a very common and prevalent condition also. About 35 million sufferers in the world, and this is forecast to increase by about 20 million people every 20 years. By 2050, we expect to have 115 million patients in the world with dementia. It's also a condition which is associated with considerable expense. The world budget for coping with this problem at present is just over $600 billion US. Now, there are many causes of dementia. Many are very well known to you, but the one that I'd like us to concentrate on this afternoon is the problem of dementia associated with cardiac conditions, and particularly with this arrhythmia known as atrial fibrillation. Atrial fibrillation is a condition when the heart beats irregularly and often rapidly. The atria are not contracting properly, and so there's an opportunity for blood to coagulate in the atrium. When these clots form, they may dislodge from the atrium, may go around the systemic circulation and end up in an important territory such as the brain. This is the well-known cause of ischemic stroke associated with atrial fibrillation. Now, I'd like us to look at current comorbidities with atrial fibrillation. These are a series of patients, some 300,000 almost, that were screened in an Italian region just in the last few years. And you'll see from the slide that I'm projecting now that cerebrovascular disease, including stroke, occurred in 18% of these patients. And importantly, dementia occurred in 15%. That is 1 out of 6 nearly of patients with atrial fibrillation have dementia. Now, that was a very recent series, but we have known about this problem for some time. For For example, if we look at the large population study in Europe known as the Rotterdam study, we can see from a publication in 1997 that dementia occurs much more commonly in patients with atrial fibrillation. This is particularly true of elderly patients before the age of 75, when particularly in women, the possibility or likelihood of developing dementia may increase 7 times. Now, of course, some of this is due to the development of stroke, but even if we eliminate and correct for the stroke factor, it's still 2 to 3 times as common as in patients who have normal sinus rhythm. So this is a very important complication of atrial fibrillation that the medical community in general have not really appreciated, even though the data has been staring at them for some time. There was a recent publication from the United States which took the opportunity to look at the Medicare database. In this database, over this time period that was explored from 1993 to 2007, there were altogether over 400,000 patients with atrial fibrillation. And it was possible to see the development of dementia in patients who presented with atrial fibrillation. So they'd not necessarily had atrial fibrillation for very long. But if you looked for dementia in these patients, it occurred in about 5% of these patients in 1993 and over 8% in 2007. In other words, dementia is being recognized more and more in association with this cardiac rhythm disturbance known as atrial fibrillation. Now, I think it's important to appreciate that dementia develops more rapidly in patients who have atrial fibrillation. And I'd like to show you these data from the cardiovascular health study. They're longitudinal data in which patients are assessed over a 5-year period. And if you look at the chart on the right of this slide, you can see that with cognitive testing, cognitive function decreases by about 6 points in patients with normal sinus rhythm over a 5-year period, going from age 80 to 85. But if you look at patients who have atrial fibrillation rather than the sinus rhythm, the cognitive decline is more. Cognitive function drops by at least 10 points, almost double the rate that is seen in normal sinus rhythm. Now, we've had now a lot of studies dealing with atrial fibrillation, looking at the issue of dementia. And on this slide, I'm showing you a meta-analysis of 14 studies, some of which were prospective and other of which were just simple longitudinal studies in which the relative risk of dementia is assessed. And the meta-analysis demonstrated that the risk was 3-fold in dementia. Now, this was particularly in patients who had had a stroke already. Now, stroke itself will give rise to an increase in dementia of about 2-fold, but that is increased by a further 50%, in some cases up to 100%, by the presence of atrial fibrillation rather than sinus rhythm. Now, why does dementia occur? Well, I think that we're pretty sure that there is a decline in brain perfusion in atrial fibrillation. And the reason for this is that the heart rhythm is irregular. We've lost the atrial component of cardiac output, so cardiac output falls. And because of the decline in cardiac output, we have a decrease in cerebral perfusion. And that's easily demonstrated in patients who've paroxysmal atrial fibrillation, and much more so in patients who have persistent or permanent atrial fibrillation. Now, this has also been shown to correlate with a decrease in brain size. In this particular graph, we're looking at the percentage of the intracranial volume which is occupied by the brain, and you can see that in persistent or permanent atrial fibrillation there is a significant reduction in brain size. Now, all of these factors contribute to the mechanism by which dementia occurs in patients with cardiovascular disease, particularly atrial fibrillation. And this shows you a rough flowchart of how that might happen. First of all, we have the same risk factors for dementia as we have for atrial fibrillation: age, hypertension, heart failure, and diabetes. Secondly, we have this decrease in cerebral perfusion, giving rise to a smaller brain size. And thirdly, we have the problem of thromboembolism, the very problem of stroke, clot which detaches and goes to the brain and causes ischemic stroke. Now, we know that it's possible to manage many of these problems. We can certainly deal with many of the comorbidities that contribute to the provocation of dementia and to atrial fibrillation, so hypertension, heart failure, and diabetes. We can also very effectively address the issue of stroke. We have very effective treatments to reduce and almost eliminate the stroke problem in atrial fibrillation using oral anticoagulants. And we also can address the issue of atrial fibrillation itself. It is possible to ablate, for example, the atrial myocardium in such a way that this arrhythmia can no longer occur. It's called pulmonary vein isolation or left atrial isolation, and it is a highly effective technique. Let me show you some of the results with these studies. Here's a very small but very seductive study showing that anticoagulation with warfarin can significantly reduce the risk of dementia. Not stroke, but dementia in this particular case. So dementia is lessened if patients are effectively anticoagulated. We can also show that statin therapy can reduce dementia. This is a study, quite a large study, which has just been published coming from Taiwan, in which you see patients with statins have half the rate of development of dementia that is seen with patients not treated with statins. These are all patients who have atrial fibrillation. And the risk factors were gender, with more strokes and more dementia in women, statins, which we see on this graph, and the underlying risk in terms of comorbidities such as heart failure, diabetes, age, and so on. Now, the third way of dealing with this issue is to try and eliminate atrial fibrillation altogether using so-called ablation techniques. And this graph shows you that mortality can be reduced with this technique, that stroke can be reduced with this technique, and much more intriguingly, dementia, whether it's vascular, whether it's Alzheimer, or whether it's senile in type, can be reduced, almost eliminated, by effective management of atrial fibrillation itself. So, Minister and members, let me conclude. We can say that atrial fibrillation is a scourge of modern society, and it's only going to get much more prevalent. We can say that dementia, similarly, is a highly prevalent condition which is getting much more common and is particularly prevalent in the elderly. We know that atrial fibrillation is associated with a doubling in the rate of stroke. And we know that the burden of atrial fibrillation and its complications can be reduced by effective anticoagulation, by statin therapy, and by ablation therapy. Now, much of these therapeutic approaches need to be confirmed, but it is time that Europe addresses this really important problem. We do have the prospect of being able to reduce dementia very significantly, particularly in patients with atrial fibrillation. Thank you for listening.